Garlic, known for its pungent aroma and robust flavor, has been celebrated for centuries for its medicinal properties. Rich in vitamins, minerals, and antioxidants, garlic can offer numerous health benefits, from boosting the immune system to reducing blood pressure. However, for certain individuals, the consumption of garlic may not be advisable. This video explores the health conditions and considerations for which people might need to avoid or limit their garlic intake. 1. Gastrointestinal issues, irritable bowel syndrome, IBS. Garlic contains fructans, a type of carbohydrate that can be difficult to digest for people with IBS. Fructans are classified as FODMAPs, fermentable oligosaccharides. Disaccharides, monosaccharides, and polyols, which can cause bloating, gas, and abdominal discomfort in sensitive individuals. People with IBS may experience exacerbated symptoms after consuming garlic. Gastroesophageal reflux disease, GERD. Garlic is known to relax the lower esophageal sphincter, which can cause or worsen acid reflux and heartburn. Individuals with GERD might find that garlic triggers or aggravates their symptoms, leading to discomfort and irritation. 2. Bleeding disorders. Garlic has natural anticoagulant properties, meaning it can thin the blood. While this can be beneficial for reducing the risk of blood clots, it poses a risk for individuals with bleeding disorders, such as hemophilia, or those on blood-thinning medications like warfarin. Consuming garlic can increase the risk of bleeding and bruising in these individuals, especially when taken in large quantities or supplements. 3. Surgery and dental procedures. Due to its blood-thinning effects, garlic should be avoided before surgery or dental procedures. It's recommended to stop consuming garlic at least 1 to 2 weeks prior to any scheduled operation to reduce the risk of excessive bleeding during and after the procedure. 4. Low blood pressure, hypotension. Garlic is well known for its ability to lower blood pressure, making it beneficial for individuals with hypertension. However, for those with already low blood pressure, consuming garlic can further decrease blood pressure levels, potentially leading to symptoms such as dizziness, fainting, and lightheadedness. It's crucial for individuals with hypotension to monitor their garlic intake and consult with a healthcare provider. 5. Allergies and sensitivities. Although rare, some individuals may be allergic or sensitive to garlic. Symptoms of a garlic allergy can range from mild to severe and include skin rashes, itching, headaches, difficulty breathing, and anaphylaxis in extreme cases. People with a known garlic allergy should avoid garlic in all forms, including fresh, powdered, and as a supplement. 6. Pregnancy and breastfeeding. While garlic is generally safe in food amounts during pregnancy and breastfeeding, consuming it in medicinal amounts may not be advisable. High doses of garlic can potentially affect the flavor of breast milk, which might not be well tolerated by infants. Pregnant and breastfeeding women should consult with their healthcare provider before taking garlic supplements. 7. Medication interactions. Garlic can interact with various medications, altering their effectiveness or increasing the risk of side effects. Notably, garlic can interact with anticoagulants and antiplatelet drugs. As mentioned earlier, garlic's blood-thinning properties can enhance the effects of these medications, increasing the risk of bleeding. Antihypertensive medications. Garlic can further lower blood pressure, which may lead to hypotension in individuals taking medication for high blood pressure. HIV/AIDS medications. Garlic supplements have been reported to reduce the effectiveness of certain antiretroviral drugs used to treat HIV. Individuals taking any of these medications should seek medical advice before incorporating garlic supplements or high amounts of garlic into their diet. Garlic has many health benefits, but it isn't suitable for everyone. People with gastrointestinal issues, bleeding disorders, low blood pressure, allergies, or those preparing for surgery should be cautious with their garlic intake. Additionally, individuals taking certain medications should consult their healthcare provider to avoid potential interactions. As with any dietary consideration, balance and individual health circumstances should guide garlic consumption to ensure it positively contributes to overall well-being.